call the member for Fowler.
Thank you, Deputy Speaker. I'd like to thank the member for Layla's motion to strengthen Medicare, I welcome the investment being made. I want to make sure that my community's voice is heard and not left behind. Yes, Medicare is being strengthened. Yes, we've seen commitment to bulk billing, urgent care clinics, hospital funding and improvements for women's health and diagnostics. And I do thank the government for listening to my community's advocacy and committing $80 million to Fairfield Hospital during the recent May election, a much-needed help, and one that I know that the opposition also wanted to match. But for my community, these efforts are only beginning, because on the ground in southwest Sydney, Medicare is not working as it should, and my electorate of Fowler is one of the hardest hit. Families in Fowler are telling me they can't find a bulk billing clinic, and when they do, appointments are booked out for weeks. Many are forced to pay an average of $42 out of pocket per visit, a cost they can not simply afford. We have some of the lowest GP to population ratios in the country. Practices are struggling to recruit doctors, and many of the GPs currently serving our community are nearing retirement, with not enough younger doctors coming in to replace them. Medical professionals are choosing to work in other parts of Sydney, where they can charge more and sustain their practices more easily. Meanwhile, our population continues to grow rapidly. Speaker, these aren't just statistics. These are everyday struggles for people in my community. For many families in Fowler, the choice is between seeing a doctor and putting food on the table. The median income in Fowler is 35% lower than the national average, and nearly 80% residents speak a language other than English at home. That diversity is our strength, but it also creates barriers in health access. Language differences can lead to misdiagnosis and delays. Cultural misunderstandings can discourage people from seeking help, especially for mental health. And many of our residents have come from backgrounds of trauma, displacement and upheaval. They carry not just physical illness, but deep emotional burdens that require culturally informed care. So when we talk about strengthening Medicare, I say this must mean meeting people where they are. That's why I call on the government to go further. Firstly, match the New South Wales Labor government's $550 million commitment to Fairfield Hospital. Our local hospital is chronically underfunded and overstretched. A one-off injections of $80 million is helpful, but it doesn't reflect the level of need in one of the most disadvantaged regions in the country. Secondly, invest in recruiting and retaining GPs in southwestern and western Sydney. And here we don't need to reinvent the wheel. The government already uses the modified Monash model, or Triple M as I call it, to classify and support rural and remote communities. Through the Workforce Incentive Program, doctors and practices in Triple M 3 to 7 areas receive location-based payments, rural loadings and support for hiring nurses, midwives and allied health staff. These programs have been successful in improving health access in regional areas. So I say, let's replicate this model in urban areas like Fowler, where healthcare access is just as urgent. Because the needs in Fairfield and Liverpool are vastly different to those in Fairlight or Linfield, and our policies must reflect that reality. And finally, we need a multicultural healthcare centre in Fowler, a one-stop shop with bilingual staff and interpreters, culturally tailored mental health care, because, Speaker, in many CALD communities, mental health is understood very differently from the mainstream. And we need outreach programs that generally connect with people's lived experience. This is not just about better health, it's about equity, dignity and inclusion. Speaker, if we're serious about strengthening Medicare, then we must look beyond national averages and focus on communities like mine, where the gap between need and access is growing wider every day. Let's not leave places like Fowler behind. Thank you, Deputy Speaker.